Hey guys, my name is Attorney Walter Knott. I'm going straight to the White House briefing, the priorities notation for COVID-19, the Biden-Harris plan to beat COVID-19. What I think is interesting is the notation of always Biden-Harris included in more White House briefings than traditionally was brought forward before, which usually originally was more president-based, but now it's more president-vice president. So maybe that's a good thing, the sharing of power, the sharing of glory, etc. Let's go ahead and read it and get into it and go from there. The American people deserve an urgent, robust, and professional response to the growing public health and economic crisis caused by the coronavirus outbreak. President Biden believes that the federal government must act swiftly and aggressively to help protect and support our families, small businesses, first responders, and caregivers essential to help us face this challenge. Those who are most vulnerable to health and economic impacts, the disabled and the retired, I put that part in, and our broader communities, not to blame others or bail out corporations. Interesting little addition there. They did a little dash. Not to blame others or bail out corporations. The Biden-Harris administration will always listen to science, ensure public health decisions are informed by public health professionals, promote trust, transparency, and common purpose and accountability in our government. That's good. That's good. Although I feel like science has been manipulated a little bit recently with how they're going to get their funding, but that is part of the game. President Biden and Vice President Harris have a 7-point plan to beat COVID-19. All right, that's good. They've got a plan. I like bullet points. Ensure all Americans have access to regular, reliable, and free testing. Good point. Double the number of drive-through testing sites. Invest in next-generation testing, including at-home tests and instant tests, so we can scale up our testing capacity by orders of magnitude. Stand up a pandemic testing board like Roosevelt's War Production Board. It's how we produce tanks, planes, uniforms, and supplies in record time, and it's how we will produce and distribute tens of millions of tests. That's a good idea. Establish a U.S. Public Health Jobs Corps to mobilize at least 100,000 Americans across the country with support from trusted local organizations and communities most at risk to perform culturally competent approaches to contact tracing and protecting at-risk populations. Obviously, a lot of Americans are not liking that because the last thing Americans want to hear is being traced by the federal government. Fix personal protective equipment, PPE, problems for good. President Biden is taking responsibility in giving states, cities, tribes, and territories the critical supplies they need. Fully use the Defense Production Act to ramp up production of masks, face shields, and other PPE so that the national supply of personal protective equipment exceeds demand in our stores and stockpiles, especially in hard-hit areas that serve disproportionately vulnerable populations, are fully replenished. Because China basically was making them all before, for the most part. Build immediately toward a future, flexible American sourced, and manufacture capability to ensure we are not dependent on other countries in a crisis. That's a China quote. That's right there. China made all of the PPE. Provide clear, consistent, evidence-based guidance for how communities should navigate the pandemic and the resources for schools, small businesses, and families to make it through. Social distancing is not a light switch. It is a dial. President Biden will direct the CDC to provide specific evidence-based guidance for how to turn the dial up or down relative to the level of risk and degree of viral spread in a community, including when to open or close certain businesses, bars, restaurants, and other spaces, when to open or close schools, and what steps they need to take to make classrooms and facilities safe, appropriate restrictions on size of gatherings, when to issue stay-at-home restrictions. Now, we know that a lot of the governors in particular states went way farther than other states, and that the other states are now having a lot of COVID issues, but that basically the governors that went way too far into the restrictions aren't having as many. But with that said, that could change because stuff spreads so easily with Delta. It's just, who knows what's going to happen. But the problem is, too, some of these restrictions, they put businesses completely out of business. This is like supposed to be a pro-small business plan, but at the same time, the number one thing this is going to kill before anything else are small businesses. So, issues. I don't know what the answer is. I see the issue. Establish a renewable fund for state and local governments to help prevent budget shortfalls, which may cause states to face steep cuts to teachers and first responders. Call on Congress to pass an emergency package to ensure schools have the additional resources they need to adapt effectively to COVID-19. Provide a restart package that helps small businesses cover the cost of operating safely, including things like plexiglass and PPE. Big quote. This isn't about politics, it's about saving lives. Big quote. Big quote right there. Plan for the effective, equitable distribution of treatments and vaccines because development isn't enough if they are effectively distributed. Invest $25 billion in a vaccine manufacturing and distribution plan that will guarantee it gets to every American cost-free. Ensure that politics plays no role in determining the safety and efficacy of any vaccine. The following 3 principles will guide the Biden-Harris administration. Put scientists in charge of all decisions on safety and efficacy. Publicly release clinical data for any vaccine the FDA approves. And authorize career staff to write a written report for public review and permit them to appear before Congress and speak publicly uncensored. Ensure everyone, not just the wealthy and well-connected, in America receives the protection and care they deserve, and consumers are not price gouged as new drugs and therapies come to market. Protect older Americans and other at high risk. Okay, cool. So I don't know if we're going into disability benefit people or retirement people or people at risk like SSI, but this is probably the section for disability. President Biden understands that older Americans and others at high risk are most vulnerable to COVID-19. Establish a COVID-19 racial and ethnic disparities task force. You guys know my thoughts on that. It is being black or brown does not make you poor. Okay? There are quite a few individuals with that skin color living in some of the most expensive places on earth. Inherently, a skin color other than this does not make you automatically be poor. It is the culture of the geography that's different from the super wealthy culture areas. And obviously, there's that major difference that is not just race-based. Because think about this. And they've been pushing into your brain all these years. Oh, hey, ethnic disparities and task force. Hey, let me try this out for size, okay? Go into a poor area. Is it all that one ethnicity? Very rare now, because there's so many people that are poor across the spectrum. Number 2, go into a poor area. Is the culture of that poor area similar to the culture of a poor area with the same skin color 15 states away, right? Or, just draw a little map to some area that's as far away as you can get, right? Across America. No, they're totally different. The cultures are totally different, which means that it proves the point that when it comes to skin color, it has nothing to do with skin color. It's everything to do with the culture of not having jobs in the area, not having education actually working, not having training beyond education that's actually working, not having the parents have enough to go ahead and raise their kids in a newfound culture towards the light of learning and doing great things and creating new products and making small businesses, etc. That's a culture thing. It is not a skin color thing. And it pisses me off because it's like spitting in the face of all the people that have a different skin color that are poor. It's like, you shouldn't be poor because you have that skin color. Do you realize how wrong that is? Do you realize how horrific that sounds? But there it is, produced at the White House, the highest house of all the houses in America. Establish a COVID-19 racial and ethnic disparities task force as proposed by Vice President Harris to provide recommendations and oversight on disparities in the public health and economic response. At the end of this health crisis, it will transition to a permanent infectious disease racial disparities task force. You take racial out of that, I'm fine with it. Infectious disease disparities task force sounds like a great idea. Infectious disease racial disparity task force, no. Terrible idea. That's a terrible idea. That's like saying, well, the people part of the LGBTQ community, gay individuals who get AIDS a lot, maybe we should look at just the brown and the black, based gay individuals first because, they fall into our selling point here. You see how wrong that sounds? You see how terribly racist it is? And here it is, the highest house of all the houses in America, promoting this. Create the nationwide pandemic dashboard that Americans can check in real time to help them gauge whether local transmission is actively occurring in their zip codes. This information is critical to helping all individuals, but especially older Americans and others at high risk, understand what level of precaution to take. I was hoping to see something in here about disability people, but I guess we're going to skip them. We're just going to focus on racial justice. Rebuild and expand defenses to predict, prevent, and mitigate pandemic threats, including those coming from China. Immediately restore the White House National Security Council. Directorate for Global Health, Security, and Biodefense, originally established by the Obama-Biden administration. Immediately restore a relationship with the World Health Organization, which, while not perfect, is essential to coordinating a global response during a pandemic. When the White House is saying, well, not perfect. Yeah, that's because if you go look at the WHO, a lot of their army personnel does not always treat or take care of the results of their actions in a particular country. There's a lot of kids, unfortunately, coming from WHO soldiers that are not getting taken care of by those WHO soldiers. But in your own time, go read about that. Relaunch and strengthen U.S. Agency for International Development's pathogen tracking program called PREDICT. Expand the number of CDC's deployed disease detectives so we have eyes and ears on the ground, including rebuilding the office in Beijing. Interesting. You wouldn't normally see the White House specifically outlining as one of their bullet points to expand the number of spies, like American spies, but that's exactly what they did here. That's interesting. Expand the number of CDC's deployed disease detectives so we have eyes and ears on the ground, including rebuilding the office in Beijing. Interesting. You would never usually see a president saying, increase the amount of spies we have, because that's what that paragraph is. That's interesting. Implement mask mandates nationwide by working with governors and mayors and by asking the American people to do what they do best, step up in a time of crisis. Okay, experts agree that tens of thousands of lives can be saved if Americans wear masks. President Biden will continue to call on every American to wear a mask when they are around people outside their household. Every governor to make that mandatory in their state. Local authorities to also make it mandatory to buttress their state orders. Once we succeed in getting beyond this pandemic, we must ensure that the millions of Americans who suffer long-term side effects from COVID don't face higher premiums or denial of health insurance because of this new pre-existing condition. The Biden-Harris administration will work to ensure that the protections for those with pre-existing conditions that were won with Obamacare are protected, and they will work to lower health care costs and expand access to quality, affordable health care through a Medicare-like public option. Okay. Everything I read from the White House is disappointing me when it comes to what's going to happen for the disabled. Originally, the documentation on the website produced by the Biden administration was super pro helping the disabled. It was super duper for the disabled. I'm having a significantly difficult time reading it into even his documentation. Like, there might be a header, but there's nothing left after that. That's pretty much it. And Shadow agrees. That's why he's climbing up under the desk. What do you want? You want a treat? Because you're the baby? You're so sweet and snuggly and I kiss you. Oh, I love you too much. You know this. So with that said, guys, everybody's going to defend saying, hey, he hasn't had time, Afghanistan, pandemic. I still stand by this. And I never want to have to go into politics, but I stand by this. If you run on a platform, you better be given updates, at least monthly ones, on where that legislation is going. You have to, right? You just have to. Otherwise, people start to lose faith that saw a major platform being derailed that you rode on. And that's not good. Okay? And I know a lot of people, he hasn't been in there a lot long. He's been in there long enough. Don't give me that shenanigan. All right. Anyways, guys, I'll catch you a little bit later if this channel helps you in any way. And I beat up both parties. But anyways, if you like this channel and you like to see me fighting for rights and trying to figure out what the heck the future is for rights for the disabled and the retired, like the channel, subscribe to the channel. Please leave 5 stars below. And remember, the bio area has how to do that. I will catch you a little bit later. Have an absolutely wonderful day. And remember, I go live from 8 to 10 every Thursday to answer any questions of people calling in. We'll catch up there and have a good time. Thanks so much. Bye-bye.